Hello, this is Kim Jong-il. Today's lecture is the third part of the expansion appliance advantages and disadvantages of the expansion appliance. Every appliance has its advantages and disadvantages. The advantage of the expansion appliance is good for resolving the posterior crossbite. It has a space-gaining effect. It is good to get the proper arch form. There is a maxillary protraction effect. It is possible to adjust the tooth axis of the posterior teeth, and Class 2 malocclusion can be resolved by itself. A narrowed nasal cavity may increase. As it makes the narrow smile line wider, it is more aesthetic. The disadvantage of the expansion appliance is age dependence and its relapse. There is a possibility of a gingival recession. Bony fenestration. When the arch is enlarged, the buccal root may be exposed. The mandible may rotate posteriorly and downwardly, and the position of the tongue may lower. Let's take a closer look at the advantages of the expansion appliance. First, it is good for resolving the posterior crossbite. There are cases with normal buccolingual overjet, half crossbite, and full crossbite. In case of half crossbite, need to be enlarged 3 mm per side, and in case of full crossbite, 6 mm of expansion is required per side. In case of expansion, overcorrection is required. It is advisable to add 6 mm to plus 2 mm to enlarge the palatal cusp of the maxilla to the point of contacting the buccal cusp of the mandible. Let's look at the unilateral crossbite and half crossbite. 3 mm per side, which is 6 mm of expansion total, is required. If you need 6 mm expansion, you get 4.2 mm of space, because you get 0.7 mm of space per 1 mm of expansion. It is possible to resolve 4.2 mm of crowding in the front. How do we turn the screw to expand 6 mm to gain 4.2 mm of space? In the SME type, it is expanded by 0.25 mm per turn. If you turn it twice a week, you should turn it for 12 weeks. 12 weeks is 3 months. In RME type, it is required to rotate once a day, so if you rotate it for 24 days or a month, it is expanded by 6 mm. In the case of bilateral crossbite and full crossbite, 6 mm per side, total 12 mm for both sides, are required to expand. How many millimeters of space can we get by expanding 12 mm? Because you get 0.7 mm space per 1 mm of expansion, you can get 8.4 mm of space. So how do you get the 12 mm of expansion? The 12 mm of expansion is quite a lot. Even if I turn once a day for 32 days, I can get only 8 mm. It would take a month and a half to 2 months. Or you need to rotate it twice a day for a month to get 12 mm. Second, the advantages of the expansion appliance to gain space. You can get 0.25 mm of space per turn. The arch perimeter increases by 0.7 mm per 1 mm of expansion. Let's compare the end of the mixed dentition and the beginning of the permanent dentition. In the control group, arch length decreases due to leeway space at the end of the mixed dentition. The arch length decreases as the posterior teeth move forward. On the other hand, the arch length does not decrease when an expansion appliance is used. In the maxilla, if the expansion appliance is used, the arch length can be secured by 5 to 6 mm compared to the control group. In the mandible, about 6 mm of arch length can be obtained through the expansion appliance compared to the control group. Third, you can get the proper arch form. The narrow dental arch can be improved by using the expansion appliance, and it can have a proper arch form. When expanded laterally, it will face resistance from the pterygoid plate, medial pterygoid plate, and lateral pterygoid plate. So, lateral expansion is limited to the rear part. Fourth, there is a maxillary protraction effect. As it expands laterally, it touches the pterygoid plate in the rear part, so that anterior region is expanded rather than posterior region due to resistance. It is expanded like picture B. In other words, compared to normal growth and development, the A point is located more anteriorly. In the case of Class 3 malocclusion, it is beneficial for treatment. When treating Class 3 malocclusion, by using a face mask, we move the maxilla anteriorly. In this case, if you use a face mask using a rapid expansion appliance on the maxilla, the effect of moving the maxilla forward is better. Fifth, proper posterior torque control is possible. In Class 2 malocclusion, the crown of the lateral tooth group is lingually inclined. Therefore, the growth of the mandible is restricted. Class 3 malocclusion has a narrow upper arch, so the crown of the maxillary molar is buccally inclined. In this case, what would happen if root buccal torque-crown lingual torque is applied on the arch wire without expansion? The root is in contact with the buccal cortical bone, so there is a high possibility of root resorption. If there is posterior crossbite, proper posterior torque can be obtained by using an expansion appliance and applying root buccal torque, crown lingual torque on the arch wire. Sixth, one of the causes of Class 2 malocclusion is the narrow dental arch of the maxilla. This leads to occlusal interference which restricts mandibular anterior growth. In other words, there is a high possibility that the mandible will be a Class 2 malocclusion located posteriorly. In this case, expanding the maxilla can cause the trapped mandible to come out anteriorly. Let's look at this from the transverse plane. In the Class 1, maxillary canines should be located between mandibular canines and the first premolar. Half Class 2 is the case where the mandibular canines are located posteriorly. Full Class 2 is the case where the mandibular canines are located more posteriorly than that the maxillary canines is. In the Class 2 malocclusion, there must be a transverse problem. Especially full Class 2 may have severe transverse problems. It is likely for the maxillary arch to be narrowed, and to solve this problem, we need expansion appliances. This patient has a large overjet. If it is skeletal Class 2, the maxillary expansion appliance can be used. However, this patient's APDI was 82. It means skeletal Class 1. If the occlusal force is removed, the mandible can grow well anteriorly and have a normal overjet. Before the treatment, evaluation of the patient's skeleton must be made to prevent us from using unnecessary appliances. Seventh, the resistance in the nasal cavity decreases. If the nasal cavity is narrow, we can expand nasal cavity while expanding maxilla. Eighth, the narrow smile line widens. If a patient has a negative space while smiling, he/she will be unesthetic. In this case, an expansion appliance is required. Let's take a closer look at the disadvantages of the expansion appliance. First, it is age-dependent. Dr. Melson said that after the age of 13, the mid-palatal suture becomes tighter compact, making it difficult to expand the maxilla. Second is relapse. Dr. Hicks says that in cases without maintenance after use of SEMs, there is 45% possibility to relapse, and 22% to 25% for cases which are using removable retainers, 10% to 23% for cases which are using a fixed retainer. He said that the amount of relapse for RME type is much higher than that of SME. Third, there is a high possibility of a gingival recession. In the case of using only the edgewise bracket, or the case of using the expansion appliance and the edgewise bracket together, which one causes the most gingival recession? In the case of using the expansion appliance and edgewise bracket on the maxilla, the gingival recession was 3 times more than that compared to the control group. Please note that RPE groups are much more likely to have gingival recession compared to edgewise groups with brackets. Fourth, fenestration may occur in which the roots are exposed outside the bone. It is likely to be bony fenestration during rapid expansion. In particular, the possibility of bony fenestration is high in the case of high-angle type with narrow alveolar bony width. Fifth, when rapidly expanding, the palatal cusp of the maxillary molar extruded, so mandible is likely to rotate backwards. Sixth, since the expansion appliance covers the palate, the position of the tongue is likely to lower. Because the maxillary bone is narrow, the position of the tongue may lower, and the position of the tongue may lower, and the maxillary bone may become narrower. They are related to each other. The maxillary expansion appliance is used when the maxillary dental arch is narrow and there is a posterior crossbite. At this point, it is important to remember that the position of the tongue has already lowered. You should use an expansion appliance, minimizing the shortcoming mentioned earlier. First, age-dependent. During the period of growth, any kind of expansion appliances are possible. On the other hand, for adults, there are restrictions on use. In particular, the appropriate appliance should be selected depending on whether the posterior crossbite is bilateral or unilateral. Second is relapse. It must be overcorrected to compensate for relapse. Until the palatal cusp of the maxilla touches the buccal cusp of the mandible, it is recommended to expand 1 to 2 millimeters more than the desired expansion amount. Dr. Bruce says the intermolar width increases by about 6 millimeters when using an expansion appliance. The control group grew by 0.9 millimeter. It grows by 4.9 millimeters in the case of the maxillary RME and 7.2 millimeters in the case of the mandibular Schwartz and the maxillary RME. Therefore, in the case of posterior crossbite and lingual inclination of mandibular posterior teeth, it is desirable to expand the mandible as well as the maxilla. Third is gingival recession, and fourth is bony fenestration. Do not apply strong force to prevent this. If possible, do not use expansion appliances. Use an edgewise appliance. Expansion arch wire mulligan. Arch wire followed by arch expansion instead. I enlarge arch with strategic leveling and alignment. RME previously turned the screw twice a day, but the author recommends turning it once a day. Turning twice a week is recommended for SME. You can also use the expansion appliance to expand laterally. You can also expand the arch by rotating the terminal molar. During arch expansion, especially the lateral tooth group region is expanded. This is what strategic leveling is. Even if I use an expansion appliance, I use it for a short time and utilize strategic leveling and alignment as soon as possible. Fifth, When expanding, the palatal cusp of the maxillary first molar extrude, so the mandible opens. This is the main problem in high-angle type. To prevent this, high-angle type requires occlusal covering of posterior teeth, bonded RME or SME PBB in the maxilla, Schwartz PBB in the mandible. Maxillary RME and mandibular PBB can be used. Let's summarize once again. When using an expansion appliance for a high-angle type, a posterior occlusal covering is required. SME PBB covers maxilla, and Schwartz PBB covers the mandible. Bonded RME is best when the rapid maxillary expansion is required. However, it is better not to use it after the eruption of the maxillary first molars because there is a high possibility of cavities. In this case, I use a mandibular PBB and a maxillary 2 expansion appliance for rapid expansion. Sixth, the position of the tongue may lower. What should we do to prevent this? The duration of use of the expansion appliance must be shortened. Treatment duration should be shortened. Nighttime wearing is recommended. In summary, to solve the shortcomings of the expansion appliance: 1. You need to choose the right appliance. Overcorrection is required. 3 and 4. Use strategic leveling and expansion arch wire to reduce gingival recession and bony fenestration. 5. To prevent mean backward rotation, a posterior bite block type that covers the occlusal surface, especially in the high-angle type, is required. 6. The tongue position may lower, so the expansion appliance should be used for as short as possible. For this, I recommend using a fixed appliance bracket while using an expansion appliance. Thank you for watching.